how sometimes the actual symptom problem is coming back. And I'm just gonna talk about this as to, in general, as to why this happens. And this is the analogy that I tell everyone, which makes a lot of sense, right? If for some reason I take this pen and I scratch myself with it and it opens up, right? For some reason, it's deep, but for some reason, I get a deep wound, it's open, I may need to suture it, or let's just say in the chest, right here, right? Chest is open, I have a wound now. Like this is metaphorically when we have our physical, mental, and emotional problems, right? And so if I were to get that sutured, there's going to be a deep layer of like, say, like this much, maybe a few centimeters down. How the body heals itself is it goes from the inside out. So the reason why we're suturing this open wound is so that the skin is together, because the skin is the barrier against bacteria, right? It's a protective mechanism. This is temporary. And if you know the testing process, this is how we suture our clients by testing. So we're taking the superficial level and closing it temporarily. This method is this method, it helps with both. Really, the real healing, what you learn here, the one principle that I teach is that of how to ask your questions. That is what's going to help the deep layer of your client's problems to resolve. And that's how you'll investigate what the real problem is.